Doctors of the World is a humanitarian aid organisation working in over 70 countries. We help vulnerable people across the world, from children in remote parts of Colombia to victims of natural disasters like the earthquake in Haiti or the famine in the Horn of Africa. We also help those in need on our own doorstep. Our clinic, Project London, was set up to assist those struggling to access mainstream healthcare services. As well as providing one-off consultations with a volunteer doctor, volunteer support workers help to advocate on the patient's behalf so everyone can get the healthcare they need.
We decided to run a project in London because we felt that there actually was a need. Since 2006 we've been running and realised that there are difficulties in accessing healthcare for certain groups of people, such as homeless, vulnerable migrants and some sex workers as well. Although many people may think it's quite easy to access healthcare, it's not so simple, and it can be quite difficult to try and overcome the barriers, especially if English isn't your first language, or you don't have the right immigration status or the right documentation that a lot of average GP surgeries will ask for.
A lot of the people that we see here don't know where else to go. They often have quite chronic illnesses that require treatment and ongoing care that in normal society such people would be seen by a GP and have automatic entitlement, if you like, to healthcare. But the people that we see here are often very confused, very frightened. They don't know who to turn to. Quite often they don't have any emotional support either. Language is often a barrier, which makes them exceptional in that sense.
We're always looking for volunteers in the clinic. We have two roles, ideally, which are non-medical roles and medical roles. And in the clinic, the non-medical person is a support worker. So they actually meet the service users, have quite in-depth conversations with them to find out why they're in the clinic, what their issues are at the time, why they've had difficulties in accessing healthcare. And then we have the medical, which in the clinic tend to be doctors, and the doctors will provide acute medical care and will also advocate further for that service user if they need kind of immediate medical care.
When I went to Project London, they listened to my story. I left Lebanon because my parents, if they find me in Lebanon, they're gonna kill us because we're not allowed to get married. He's Christian and I'm Muslim. I went to the GP because I need to see the doctor. I was pregnant, but I couldn't have a doctor because I don't have enough paper, proof of address, and too many things to register in the GP. When I came to UK, my husband have little money. We rent a room and the money later is finished. It's very expensive here. And we don't have money. We went to Home Office, we applied for asylum seeker. They refused us, and it's very hard. When I think back, one year back, it's a horrible. Thanks God I find Project London, otherwise now I don't know where I will be.